bringing together voices in child and youth healthcare. This is CAFC Presents.
CAFC would like to thank the following member organizations for their generous support of our knowledge translation activities: the IWK Health Centre, the Children's Health Foundation of London, the McMaster Children's Hospital Foundation, the Children's Hospital of Eastern Ontario Research Institute, the Children's Hospital Foundation of Manitoba, the Montreal Children's Hospital Foundation, and the Holland Bloorview Childrens Rehabilitation Hospital Foundation. We would also like to thank the following Keystone partners for their ongoing contributions that support all of CAFC's programs and activities. All right, hello everyone, and welcome to today's episode of CAFC Presents. My name is Doug Maynard, and I'm the Associate Director at CAFC, the Canadian Association of Pediatric Health Centres. And today's webinar is titled Providing Peer Support for Families of Children with Complex Needs, a Best Practice Toolkit. All right, so as I mentioned, we're starting sort of an inadvertent series related to peer support. We ended up having two topics related to peer support back to back, this being the first one in our schedule, and it'll be interesting to see how the themes of peer support weave their way from this week to next with two very different topics, but where peer support is a common theme. So it's always my pleasure to welcome back the members of the Evidence to Care team from Holland Bloorview Kids Rehabilitation Hospital. Always lots of great work coming from the team at Holland Bloorview in Toronto. And it's great to have them back on the CAFC Present stage again. So I'll just introduce our panel today. First, we'll be hearing from Shauna Kingsnorth, who is a developmental psychologist at Holland Bloorview Kids Rehabilitation Hospital, and she's also the lead of the Evidence to Care team since its launch. She's also a clinical study investigator at the Bloorview Research Institute and an assistant professor at the University of Toronto. We also have Christine Providenza, who's a kinesiologist and has been a knowledge translation specialist at Holland Bloorview Kids Rehab Hospital for the last 3 years, and her work has focused on the development and delivery of sport-based injury prevention programs and concussion education and knowledge transfer initiatives for athletes, coaches, and parents. And also joining them is Julia Shipke. She has a background in public health and patient education and has been a knowledge broker at Holland Bloorview Kids Rehabilitation Hospital for the last 2.5 years. And Julia is passionate about translating research evidence into practice in the field of childhood disability. And last but certainly not least, Laurie Beasley is a family-centered care specialist at Holland Bloorview and the Bloorview Research Institute, and she currently manages the Family Leadership Program and is involved in expanding family engagement in research. So a great team of presenters, and it's my pleasure to hand the virtual podium over to the team at Holland Bloorview. Over to you guys.
Great, thank you very much. Hello everybody out there. I thought I'd just start, and it's Shauna speaking here, by giving a bit of an overview of what we plan to speak about. So we'd like to start by setting the stage for the work and giving you some of the background around what the impetus for developing a peer support best practice toolkit was. Then we'll walk through all the different activities that we went through to actually create the product. We'll share with you some of the specific toolkit content and talk about opportunities for use in your setting, and then finally share some of the strategies that we're using to spread the word. And I'm glad that social media was mentioned, so feel free to also use our Twitter handle as well, or hashtag, in terms of talking about this work online. So we thought we'd get started by having a chance to hear who's in the audience today, and we invite you to take part in the poll and tell us who's joined us.
Those of you who are new to the webinar, this is your chance to just respond to the question by clicking on the screen. So just go ahead up and click your choice just to identify sort of what best fits your description or your role as frontline clinician, administrator, researcher, patient or family, or others. Like most people are frontline clinicians at 43%, followed by administrators at 21%. And a large group of others in there. I'm not sure who that would be, but 10% family and 7% researchers.
Excellent. Well, we often fall in the other category, so we welcome everyone. So the next question that we wanted to ask of the audience is, in your role, do you offer peer support programs in your settings?
It looks like 63% have said yes, that they do offer peer support programs, and 37% said no.
Okay, great. Well, we look forward to hearing your questions and having an opportunity to talk about your experiences and opportunities you see for using the toolkit. So I'll get us started with the background. So as mentioned, this work took place at Holland Bloorview Kids Rehabilitation Hospital, and we're located in Toronto and are Canada's largest pediatric hospital, and we serve children from birth to 19 years of age with a range of physical disabilities and ongoing complex health needs. And we have clinical staff, scientists, and trainees who pioneer treatments, technologies, therapies, and real-world programs to give children and their families the tools they need to participate in life. And so as an academic health science center and a leader in childhood disability, knowledge translation is central to supporting the hospital's strategic vision. And the toolkit that we're going to be discussing today was led by Evidence to Care, and we form a specialized team of knowledge translation specialists who support the hospital in its aims to both accelerate knowledge and transform care. And the vision for Evidence to Care that we support is really to promote the best available research evidence in order to impact quality of care in childhood disability. So in 2013, Evidence to Care partnered with the Ontario Ministry of Health and Long-Term Care with the goal of supporting a best practice project. And specifically supporting families of children with medical complexity was identified as a priority by the ministry. And through a number of priority and consensus activities, caregiver stress really stood out as a significant concern, particularly around interventions that could ameliorate it. And so from that, we identified that there was a need to focus on peer support. One of our first tasks was to define what we meant by peer support. And the following definition by Sartor and colleagues resonated with our working group members and really refers to peer support as the existence of a community of common interest where people gather in multiple ways via in-person, virtually by telephone, or even online through computers to really share their experiences, to have an opportunity to ask questions, and critically to both provide emotional support and self-help and receive it. And so consistent with this definition, our project that we're going to be sharing with you really focuses on the provision of social and informational support for family caregivers, rather than training or other programs that aim to improve parenting skills or target specific children's behaviors. In addition, as we're talking about definitions, we also defined family broadly for this work. And so this includes parents, siblings, grandparents, and other key members, recognizing that family units can be broad and many people will be called upon to play caregiving roles around a child who has medical complexity. So I'm going to pass it over to Julia now to talk more about the processes we went through.
Thanks, Shauna. So with the definition to frame the work, I'm going to walk you through how we developed the peer support toolkit. So once we landed on peer support as our priority area, we quickly engaged family leaders and program providers to understand how Evidence to Care could support this work from the end user perspective. Through focus groups and our already established steering committee, we heard that there was a lack of resources and expertise to search for research evidence on peer support. We also heard that information and resources was already out there, but there was a need to synthesize this information in one centralized place and tailor it to the disability context. And lastly, our end users said that there was a need for a practical, user-friendly resource to support program providers. Our next question was, how could we gather this information and share it in a user-friendly way? So we decided to compile this information in the form of a toolkit. To do so, we engaged experts, reviewed resources, and did a rapid evidence review. We engaged over 30 peer support experts, including family leaders and program providers. Given the Ontario Ministry of Health and Long-Term Care mandate, the work definitely had a strong provincial focus. As mentioned, before we started toolkit development, we invited community stakeholders to focus groups to get a better sense of what should be included in the toolkit and how this information should be shared. A number of these participants also joined a smaller working group to help us create this resource and review content along the way. Evidence to Care embraces an integrated knowledge translation approach, which is strongly aligned with the hospital's principles around client and family-centered care. Integrated knowledge translation is really about bringing end users together to develop solutions to address an issue. This project, including earlier phases of the work, involved 37 organizations and 90 individuals, including 10 family leaders. And this slide just provides a snapshot of some of the organizations that were involved. In addition to engaging experts, we also look to related peer support resources and toolkits from other sectors. For example, there has been a lot of work done on peer support in the field of mental health and addictions and breastfeeding. Reviewing these resources allowed us to gather information on peer support definitions, models, frameworks, and resources and templates to include. It also allowed us to generate ideas for how we would format and set up the toolkit. And again, this slide just provides a few examples of some of the resources and toolkits we look to, including the parent-to-parent handbook, peer support strategies in maternal and newborn health, and a peer support guide for parents of children or youth with mental health problems. To complement these activities, we also completed a rapid evidence review. And this type of review aims to quickly assess the literature on a topic in a defined time window. And specifically, we look to review level articles such as systematic reviews and scoping reviews on the topic of peer support for families of children with medical complexity and other lifelong disabilities. Through the search, we identified over 1,400 articles, of which 6 reviews met our inclusion criteria. Through these reviews, we identified various models of providing peer support. For example, in-person support groups, online support, and parent matching or one-to-one support, which we're going to speak to a little bit later. Across reviews, it was noted that peer support programs are very diverse in their structure and setup, which makes sense, as we know that there really is no one-size-fits-all approach to providing peer support, which is something we heard from our family leaders and program providers. There are also a number of positive benefits associated with peer support in the literature, such as increased parent satisfaction, having a shared social identity, providing informational and emotional support, and enhanced coping skills, to name a few. Overall, qualitative studies showed positive findings associated with peer support. Through this type of method, parents' personal perceptions of the value of peer support become very evident. For the quantitative studies, the picture isn't so clear. It is hard to quantify and objectify the benefits of peer support, and we don't always have the right measurement tools to do so. So while some studies showed positive effects, others showed none. Across reviews, we found that no one approach or model to providing peer support, whether it be in-person, online, or one-on-one, was found to be more effective. And in fact, comparisons across these models were not explicitly addressed in the literature. And again, as there is no one-size-fits-all approach to providing peer support, it may be difficult to make these comparisons. Overall, we also found a lack of studies targeting caregivers of children with medical complexity and other lifelong disabilities, and the need for more rigorous research on this topic. One area in particular that requires more research is better understanding meaningful indicators and outcome measures when evaluating peer support programs. So how do we know if peer support is effective? How do we even define this? And finally, we did find a Cochrane review protocol that is underway that aims to address a number of the questions we had when doing this review. And the findings from this review will likely make a significant contribution to the field. And the result of these activities is our final peer support toolkit. We have structured this resource into 4 sections, which can be freely downloaded from our website at www.hollandbloorview.ca/peer-toolkit. And now I'm going to hand it over to Christine to walk you through the different sections.
Thanks, Julia. So I'm going to talk about the different sections of the toolkit and how it can be used in your setting. The goals of the toolkit are to increase awareness of the role that peer support plays in supporting families, provide a synthesis of current peer support research, as well as provide a resource to facilitate program providers in designing, delivering, evaluating, and sustaining programs. I'm now going to give you a sneak peek of each section of the toolkit and how it can be used. So if you're looking for the state of the evidence and you want to read some key research articles about peer support, then you should take a look at the Rapid Evidence Review. Here's a sneak peek. In this section, you will find a rich description of the methodology and key findings of the peer support literature and outcome measures used in various studies. It also provides summaries of relevant systematic reviews. So if you are building a case for funding, this section may be valuable to demonstrate the evidence to support peer support programming. If you're looking for background information and research on evidence of peer support, or you want to have an understanding of families' experiences with peer support, then Section 1 is where you should start. Section 1 also identifies 3 key peer support models: in-person, online, and parent matching. When creating this toolkit with our working group, we heard from them that they spend a lot of time reading through multiple resources and going to several places to find the information that they're looking for. They really identified a need to have a single resource that brings together all 3 models. So we work closely with our members to provide a summary of each model and identify key characteristics, successes, and challenges, and links to resources. So I'm going to walk through each model now. The first model is in-person, face-to-face peer support, which involves a voluntary gathering of people who share common experiences and who offer each other emotional and practical support. These groups can be professionally led, peer-led, or a combination of both professionals and peers working together to facilitate the group. Here's a quote from a family member talking about the value of in-person support. Let the parents take the lead at the sessions, but ensure everyone has an opportunity to share. Having new and experienced parents together can have incredible results and create lifelong bonds. The second model we showcase is online peer support, which uses technology to connect peers. It can be open or private and offered via discussion board, chat, email, live meetings, and open group forums, just to name a few. Some key considerations when developing online programs is the value of having a designated person as a moderator to facilitate discussions, monitor safety, answer questions, and as well as confirm the accuracy of the information. So here's a quote from a family member talking about the value of online support and the importance of creating a safe environment for sharing. For online support, the parents must be made to feel comfortable and safe to share their experiences. The last model is parent-to-parent support. So with this model, parents are matched one-on-one with other parents by virtue of a shared experience. Parents are matched based on criteria to ensure the relationship meets the needs of both parents involved. And these programs are flexible and vary in their structure and set up to meet the needs of the setting or the context. Here's a quote from a parent about parent matching. Peer supports are often selected because their child is out of the woods and doing well. However, this overlooks parents who may have come to a different degree of acceptance of their child and can offer a mature perspective to a less experienced parent. So this quote comes from Jennifer. Her son Owen had multiple severe disabilities all of his life. He was diagnosed primarily with cerebral palsy, but they never knew the underlying cause. He was deaf, non-ambulatory, G-tube fed, incontinent, and required full support for all aspects of daily living. He died at age 12. Although Jennifer's experience was not overly successful, in the story she shared with us, she indicated that there is no bad support and would encourage parents to consider accepting support if offered. Jennifer's experience highlights the importance of finding the right type of peer support. So here's a sneak peek at the family stories. The stories that we showcase provide various perspectives on peer support, ranging from challenges to finding the right type of support to the value of connecting with others who truly get it in terms of the journey that a family experiences when caring for a child with medical complexity or other lifelong disabilities. If you're looking to get a sense of some of the different peer support programs that are out there and how they work, then check out Section 2. In this section, a variety of programs across Ontario are highlighted through a case study approach. For each program, a program description, facilitators and barriers to program development and delivery are shared. There are key recommendations to consider when developing a peer support program are also provided, as well as information contacts. The case studies that we share highlight a variety of in-person, online, and pair matching programs that are delivered across the province. Many of our working group members contributed these case studies. Here are some examples of programs that are featured: Ability Online, Parent Coffee Break offered by Algoma Public Health, and Parent Advocacy Link offered by 3-2-B, to name a few. Here's a sneak peek of 2 case studies: Youth Sibling Support Group offered by Extend a Family, an online support network for families caring for medically complex children offered by Sick Kids. As you can see, there is a program description, identify successes and challenges, recommendations for developing a peer support program, and contact information. This section provides practical information, the do's and don'ts of creating peer support programs. For example, from Sick Kids, there were more challenges than successes. It is an example of, what if you build it and they don't come? With this example, they are gathering feedback to help inform key learning. What is valuable about this section is that it provides a platform for individuals who are thinking about creating a program or want to tweak an existing program to network. Contacts are readily available for individuals to connect. So I'm going to turn it over to Lori to share a case study from the Holland Bloorview setting.
Thank you. In the fall of 2014, we launched 2 parent talks at Holland Bloorview, one for parents of children with autism and one for parents of children with cerebral palsy. The year before, we had run a pilot parent talk for parents of children with autism. This was supported by the Autism Treatment Network and was developed with staff from the ATN along with 2 of Holland Bloorview family leaders who saw a need for the program like this. It was very successful. Last year, we expanded both of the programs, so the Autism Parent Talk now includes parents of children with all developmental disabilities, and the Cerebral Palsy Night includes all parents of children with a physical disability. We developed the program with input from families to ensure we were delivering a program that was relevant, meaningful, and accessible. We run these in the evenings for approximately once a month, and they're open to everyone, not just Holland Bloorview families. I facilitate these evenings, and I'm also a parent of a child with a developmental disability and autism. I know that parents really like this since they tell me they appreciate knowing that I'm walking the same path as them, and they can relate to me and I can empathize with them. Parent talks run officially for about an hour and a half, but parents tend to hang around afterwards, especially the autism parents, for up to an additional hour or even more. That's when I know we're having a really successful night. I do have a guest expert come in who speaks about a topic that is relevant to the population on hand, but they only present for about 15 to 20 minutes with lots of talking points and questions thrown out to the parents along the way. We not only allow the parents to talk and share, we encourage it. In fact, it's another sign of success when there's so much parent-to-parent sharing in the group that the guest speakers don't finish their presentations sometimes. I'm sure you've all been to workshops where there's supposed to be lots of discussion and interaction, only to have the speaker leave 5 minutes at the end for it. Meanwhile, people are stand around in the parking lot afterwards and have all these really rich discussions. What we wanted to do was capture those interactions and allow them to happen inside during the actual event. So this is a photo that was taken of some of the group that attended one of the Autism Parent Talks from last year, and it also coincided with World Autism Awareness Day. So just for fun, we encouraged people to wear blue when they came out, and we had blue lollipops for everybody, and it was just such a great night. My advice would be to advertise a lot, both through email and social media channels. Have a sign-up sheet at every single parent talk so that you capture people's emails and you can include them when you send out the flyer for the next event. If possible, have childcare available and stress that this is a parent-only event, and even offer light refreshments. Make sure you get feedback from the families by way of the evaluation forms and include a spot for suggestions from them for future topics. I also make a point of greeting everyone as they arrive and ensure they feel comfortable and welcome. As you get to know the participants and start to get regulars coming out, you can also facilitate introductions between the parents. When I see people sharing not only life experiences but emails with each other, I know that we're really being successful.
Thanks, Lori. So if you're looking for resources to help you get started, then this is the section to focus on. In this section, information and best practices from other toolkits is shared using a frequently asked questions style to guide the program providers. There is a great resource matrix which synthesizes this information and provides links to the resources. There are also templates to help program providers identify SMART goals for their program and evaluate the impact of the program. So our team wanted to get a sense from all of you of the types of resources that you find helpful or would find the most helpful or that you would need to have success in developing and offering peer support programs. So we were wondering if you could type in some of the resources that you would find most helpful or need to help you.
Yeah, so just for the audience, if you just want to respond by just typing something into the question box, just give us a sense of what types of practical resources you would find most helpful. Just any suggestions that you might have, just type them into the question box, and we'll give you a few seconds to do that, and we'll come back and see what the audience is saying. So we've got one-page summaries and one-page tip sheets, links to web support, sample meeting agendas. We'll let a few more suggestions come in. Yeah, she says, Jan says that the toolkit resources are very helpful. A facilitation tip sheet is another one. Sample themes or sample topics for discussion.
That's great. Thanks, everybody, for that feedback. So we asked this very same question in our focus groups to ensure that this section was informed by the people on the ground. So here's a sneak peek. This section of the toolkit provides salient information to program providers. For example, some questions we heard from our end users were, how can I find funding? How do I decide on topics for my peer support sessions? What can I do to take care of myself so that I can continue supporting the group? We outlined 16 questions with additional resources attached to each section. Here's a snapshot of the resource matrix, which provides a summary of all resources we looked at to inform the FAQ answers. What is great about all three of the sections of the toolkit is that they are informed by our knowledge users, individuals who are running a program, individuals who want to create a program, volunteers, parents, and clinicians, just to name a few. The content that they wanted for the toolkit is all there. As I mentioned, we also include a few templates for program providers to use in their context. For example, one thing we read in the literature is the need to evaluate peer support programs. So we created this evaluation planning template for program providers to outline their evaluation goals as well as their processes and resources for getting the information they need, whether it be to augment or share the success of their program. This type of information is important to demonstrate the need for peer support programs and funding. So I'm going to turn it over to Lori, who's going to talk about how she is currently using the peer support toolkit to inform her work.
So right now we have a really successful mentorship program at Holland Bloorview, but it's much smaller than what we would like it to be. It's overseen by our family support specialists. We have members of the family leadership program come in for regular once-a-week shifts as unpaid volunteers. They commit to doing a 2.5-hour shift, and they go up to the inpatient unit, they go to the outpatient waiting room area, and they perform one-on-one consultations. They talk to parents about topics like respite, education, and the all-important self-care. They also share their own stories, because they're all parents of children with special needs, their experiences and advice in areas like navigating the hospital and the overall healthcare system. I find the peer toolkit a very valuable resource in planning to review the mentor role within the family leadership program. We decided to use it as a guide. We want to look at best practices and learn from what others are doing. We want to look at other ways to expand into additional areas to help, like emailing, telephone, and online support. And this tool really captures information that would have taken us countless hours to try and find ourselves. It's easy to read, it contains the family voice, and it has great material. So now that you've seen all the elements of the toolkit, I hope you're excited to see how it might fit into your programming at your hospital or organization.
Great, thanks, Laurie. So spreading the word is really where we're at right now with this project, and I'm going to be talking and sharing with you our communication plan to achieve this goal. So to really set the stage for active knowledge sharing, we developed a comprehensive communication plan in partnership with our communications department here. And the toolkit was officially launched in the fall of 2015. And we did this through an in-house event that was a formal lunch hour talk as part of our Knowledge Connection series within the hospital, which is a variation of Grand Rounds. We used a lot of storytelling strategies by showcasing the work both internally on our intranet system as well as externally, posting stories on our external webpage, talking about this work through our organization's Bloom blog, and working with our communications department to put out a media release. In addition to today's webinar, we've also previously shared this work through the Ontario Association of Children's Rehab Services Conference, as well as at the Canadian Family Advisory Network Conference this past fall. As Julia mentioned, we've been working with smaller working groups and a broader steering group, and from this we have a very experienced, excited, and passionate group of supporters who all actively helped create the product and most importantly have continued to act as champions to help share the resource across Ontario and beyond. To help them in this role, we created pre-packaged materials such as postcards, an elevator speech, and a tracking log that they could use to help share it within their circles. They've been doing so in face-to-face meetings with their contacts, sharing it on listservs and other networks that they're linked to. And importantly, beyond this, we've also been using a social media strategy to spread the word through Twitter, Facebook, and LinkedIn. And a final strategy that our team has used has been to send targeted letters to our stakeholders, also relevant listservs and associations, as another means to spread the word. I'd just like to share with you some of the successes that we've seen in our efforts to raise awareness to date. We've had wide pickup through complex listservs in the States, and the media release led to feature stories by Longwoods, which publishes in academic and scientific arenas, as well as in Healthscape, which is supported by the Ontario Health Association. We've sent out over 75 targeted letters, and certainly promotion through this recent webinar bumped our webpage hits up to over 2,000. Some of the downloads that we've seen have been across Canada, particularly in Ontario, Alberta, and British Columbia, and throughout the United States, reaching as far as Minnesota, Florida, Texas, Phoenix, Illinois, and Washington. And we're pretty excited to see Japan, Argentina, Scotland, and Ireland also on our download list. So I'd just like to share a little bit of the Twitter conversation that's happening around the toolkit. One of our partners with the project, CTN, indicated that they found the toolkit easy to use for agencies and organizations. PCMCH also helped us share and promote it, and broader reach from our partners. And so we encourage you to join the conversation using the hashtag Holland Bloorview, capital HB, Peer Toolkit. So to help bring our presentation to a close and open it up for some questions, we wanted to share with you a few quotes demonstrating the early impact of this work from our working group members, our community partners, and toolkit downloaders. So one working group member commented that this will be such a useful tool for people supporting families. This individual liked the combination of practical strategies combined with real-life examples. We also heard from individuals outside of our working group who downloaded the toolkit for their own use, and this individual indicated that they liked how the toolkit provided best practices as well as a landscape scan of similar programs which they were able to use by contacting the experts listed. Finally, we heard that this is an area of incredible growth and learning, and doing so and hearing from others who have gone down the path before them can save an individual a lot of time and effort if they're just starting out. And this is really one of our key goals that we were aligning in terms of what we initially heard through our focus group, that there was a real need to synthesize, to gather, to centralize, and we feel we've been quite successful in achieving those aims. And this has really been a key benefit of taking an integrated knowledge translation approach, working together to co-create the best practice possible that meets the needs of those who will be using it. And so we hope that you'll also find this resource valuable in your own practice, and we look forward to hearing your feedback as well as engaging you as a potential champion to get the word out. So Julia had previously shared where you can find the toolkit on our website. Again, it's www.hollandbloorview.ca/peer-toolkit. It is freely available, but we do kindly invite anybody who's downloading it to provide some contact information, which allows us to track the reach and the spread and follow up with any updates in the future. Beyond this presentation, you can contact us at evidence2care@hollandbloorview.ca or reach out by using our Twitter hashtag. And so just before turning it over for questions, we'd like to acknowledge all the participants of the peer support focus group, the members of our working group and steering committee for their contributions to the work. We'd also importantly like to recognize the families who so generously shared their stories and helped shape our thinking around this work. So in particular, Sonia, Jennifer, Melody, Darren, and Stuart. And once again, to acknowledge our funding support from the Government of Ontario, as well as the Holland Bloorview Kids Rehabilitation Hospital Foundation. And so that brings the formal part of the presentation to a close, and now we'd like to hand it over to see if there's an opportunity for some discussion.
All right. Once again, as always, from the Evidence to Care team, a very concise and tight presentation with tons of great information, and as always, leaves our little room for questions. You do such a great job of conveying the content that there's not that many questions left in the end. So just as we said, type in any questions that you do have for the team. Please do type them in. Lisa did put the link to the toolkit that you saw on the screen there. She put that into the chat box, so you should be able to just click on that or at least copy and paste it into your browser, and we encourage everyone to do that so we can. And we're happy to help you get over 2,000 hits for your for the website, and hopefully we can continue to help with that. The one question that did come in was around online support or virtual support for individuals who are sort of reluctant to engage in person, or because they're shy, or for whatever reason. Is that part of the program, or is that a component of the program, even maybe even from the perspective of introducing people to the sort of the in-person engagement activities?
No, we don't have that component currently as part of our mentorship program here at Holland Bloorview. It's something that we're going to be looking to develop in the future, sometime over the next year. It's challenging because of security and confidentiality. That is always first and foremost when we think about setting up that kind of a situation. So we just want to make sure that we've really got all of that in place and secure before we would we have that set up, or before we begin that.
Yeah, it's always a challenge once you sort of get outside of the physical walls of the building. Things sort of get out of control. Yeah.
But there is a big demand for that, because sometimes accessibility, planning around childcare, depending on your child's needs, being able to attend in person isn't always that feasible. And so I think it speaks to Christine's points that she was reiterating around what we heard and what we saw in the literature, is that there really is no one-size-fits-all, and different families may need different types of peer support models at different stages in their family's journey. And so having kind of a myriad of choices is really, ideally the ultimate goal. Yeah. So that you could get support at midnight if you need it, or at 6 o'clock on a Monday evening. That there's choices and options for what you need at that particular time.
Yeah. What we do have is we have a dedicated email address and phone number extension, so that families can either email in questions or concerns or just a request to have one of the family leaders who is a mentor contact them either through email or through a phone call, so they can have the opportunity to leave their contact information. And then when the parent mentors do come in, the family leader mentors come in, they check the email, they check the phone messages, and then they get in touch with people the way that they would like them to get in contact with.
Yeah, and that's also a good point about the people who have difficulty traveling. I mean, for an organization like Holland Bloorview, or for many of our children's hospitals or other tertiary centers that are drawing from large catchment areas, attending in person is often a challenge. So whether it's online or virtual presence through webcams or whatever, that I'm sure there must be a lot of demand, but still lots of issues around how to implement that.
Yeah, and we found in the past that when we did have parent support groups and we did have a video camera in the room, parents tended to not like that. They really wanted to come and share with the people that were in the room. They felt less secure with sharing when they knew that there was being the session was being videotaped. So we actually, at the request of the majority of the parents, we no longer videotape or share live our parent support groups because of that.
Very interesting. All right, we had a question come in from Carrie. She says, thanks for all the great information. She's already printed it and ready to go into a binder. She says she works with First Nations people. Were there any resources that you found specifically for First Nations people or that were found to give the most support to First Nations?
I don't think we came across that specifically, although some of the resources we include might speak to that in their resources, but right at the moment, nothing comes to mind specifically.
Yeah. And I would say that, probably a population similar to thinking about children with complex medical needs, but what we found in terms of resources very much tailored, that we saw more broad or more generic resources that we were drawing from, or they were very much focused on public health, breastfeeding, mental health, but when it was really being drawn into a population, we were having to pull best practices and extract them from these other larger groups where work was behind it. So certainly one of our, outputs or key messages is that even though there is a lot of literature around peer support and a lot of common principles that can be applied, there still are very unique needs that different populations of individuals experience. And so despite the broad, we still need to be moving forward research and program evaluation and other activities to really capture the unique nuances of how we can best support families, whether it's with a First Nations perspective, children with medical complexity, or physical disabilities more broadly.
Microphone. We did have a question from Rebecca who said, she's asking, can you speak about the leadership training programs for families who want to be mentors?
Oh, Lori, that's a good question.
Yeah, so right now, that's something that we are looking at and reevaluating. When a parent becomes a family leader at Holland Bloorview and I onboard them, they do go through an extensive training with me. We have a whole family leadership program book that covers everything from the values and principles of the organization to what to do in case a child comes up to you in the elevator and says, and a report of abuse, to confidentiality, to how to conduct yourself in a meeting, the advantage of joining the program, all sorts of things. We sort of cover everything. And then for the parents who are going to become family mentors, they have to be an experienced family leader. We don't bring somebody on board and say, oh, you could be a family mentor right away. We do make sure that the family leaders are people that have been with the program and that we've really gotten to know very well. And then the family support specialist who oversees the program provides additional training. There's about 8 hours of additional training that they go through. And then they shadow an existing mentor as well. And they do that for a period of time. And all of our mentors that are here, and again, there's only a handful of them, they make sure that they work really closely with our family support specialists so that they're giving really up-to-date and accurate information. And a couple of them have social worker backgrounds, professional backgrounds, and then a couple of them are very experienced parents. Well, everybody's very experienced parents, but with no health care background. And they do things like they go up to the inpatient unit. They encourage the parents to come down and have a break from their child's bedside. We do have an inpatient parent talk that's held every Wednesday morning for an hour. So just to give them a break and that they can talk to another parent. And then they'll go up and just sort of walk through the inpatient waiting area and find out if, the outpatient waiting area to see if there's anybody who has any questions or concerns. And sometimes it's just nice to share with another parent who's going through what you've been through or a similar situation.
I just wanted to flag too, we came across one great resource out of the U.S., the Parent-to-Parent Handbook, which is all about one-to-one support and they've even created templates with all training materials that they use and sign-in sheets and all of that as well. So if you're really interested in that particular model, that's a great resource to look to as well.
Yeah.
Thank you very much. Carrie, who was asking the question about First Nations families, she provided a link to a document around medically complex First Nations families with medically complex health needs from the University of Manitoba, not necessarily specific to peer support, but maybe to help individuals identify what the unique issues might be for those communities. She also she says she's always looking for more information and tools and resources to help with First Nations families, and she's left her email address, so I'll put that in the chat box as well. Sorry, go ahead.
Oh, I just said fantastic. Thank you.
Yeah. All right. Gilles says his question was that he said it wasn't clear if there was a professional included in the peer support group. Can you just clarify that?
Sorry, can you repeat the?
Gilles just saying he said it wasn't clear when he was listening if there was a professional included in the peer support group. If you can just clarify that or elaborate a little bit.
Yeah, absolutely. Sorry, do you want to speak?
So we had a number of levels of individuals that we engaged in the work, and so they were at a steering committee level as well as our working group level. Among those members, we had members of the evidence care team. We had family leaders. And then as well, we had a range of disciplines across the hospital as well as among our community providers. And I'll let Julia speak to some of the kind of professional roles and agencies that were part of the voices informing the work.
Absolutely. Thanks, Shauna. We had nurses, social workers, family support specialists, managers and directors of programs, and then again, a lot of community partners across Ontario, so Children's Treatment Network or Grandview Kids, Ability Online, so executive directors, so really ranging from family leaders, frontline staff to the manager director level as well. And across different sectors, so acute care, we had some representation from the Hospital for Sick Children, more rehab facilities, and again, this work was supported by the Ministry of Health and Long-Term Care. So in earlier phases of this work, we also had some ministry representation to be at the table with us as well.
And speaking of Grandview Children's Center, we just had a comment come in related to the first discussion about sort of online sort of peer support groups, and Andrea saying that Grandview Children's has a closed Facebook group to try and help in that area. She says it's one of the #1 things that they hear is around childcare and timing issues as key blocks to networking and peer support. So.
Mm-hmm. And we have a parent Facebook page called as well, called Parent Voices, and lots of people are on there from across Canada and internationally and asking all kinds of questions, and there's a really, really rich ongoing discussion on Facebook, our Facebook page as well, all the time.
Interesting too, when we first started this work and we interviewed many families, a lot of them pointed to online closed Facebook groups as one of their main sources of support. So we found that really interesting around the rise of social media and how that is now playing a key role in terms of peer support interventions.
Yeah, and we did a sort of a 3-part series on social media and healthcare over the past, I think, starting back in November. So if anyone wants information about what a number of hospitals are doing, we had a couple of people who have done research in the area of connecting patients with healthcare providers using social media, etc. Just search on our Knowledge Exchange Network under social media, and you might get some examples of what some other organizations are doing exactly along that line. The last question that we have that's come in so far, and that's just my warning that we may be wrapping up soon. If you have a question, please get those fingers on the keyboard and type that in as quickly as you can. So this is the last one that we have for now. But Rebecca's asking if you compensate family leaders and or mentors for travel or childcare or any other expenses that they might incur as part of their mentorship role.
Oh, thank you. That is a common question that comes up from time to time. All of our family leaders are 100% volunteers. We do have free childcare here. We have a Ronald McDonald playroom that's open. So if somebody did need to drop off their children while they were here, then they would do that. And we do have that the playroom open in the evenings during parent talk. But the actual mentors themselves do not get paid. They get their parking paid for, and then free childcare if they need it. But a lot of our family leaders, all the parent mentors that we currently have children that are in school during the day, and one of them, their child's graduated. So there is no need for them to have childcare paid for.
All right. And it looks like that is the end of our questions. So I guess it's maybe a good time to wrap this up. And what we'll do is we'll just maybe send it back to the team at Holland Bloorview, and we'll just let you guys just have a free for all, fight amongst yourselves, there, the four of you, just for any closing comments that you would, any key messages you'd like to leave the audience with as we wrap up. You can either just do rock paper scissors for one of you to speak, or all four of you to share any thoughts if you.
So it's Shauna here, and I think I'll speak on behalf of the team, and thank you for your time in joining us for this webinar today. We actively encourage you to download your own copy, to read it, to use it, to share it, and to reach back out to us about what you liked about it, where we could gather new ideas about how we could expand on it. This type of toolkit and toolbox activity is a key focus of what Evidence to Care is engaging in under our goal of mobilizing research evidence in childhood disability. We've also done work around a chronic pain assessment toolkit, and we'll be starting a new project. And so hearing back from end users really helps us do a better job at meeting the needs. And so whether it's about the toolkit or whether you'd like to connect with the Evidence to Care team about our working model, or linking you to Lori to learn more about the Family Leadership Program and her role as a family care specialist here within the hospital, we'd be happy to facilitate and broker and help network. And I think that's all I'll say. Any last words from our panel here? No? No. Well, I'll also thank the team for all the behind-the-scenes work that they did pulling together this presentation and setting this up. And thank you to CAPC for this opportunity.
Oh, well, thank you. As always, it's great to hear from you guys at the Evidence to Care team at Holland Bloorview. There's lots of great work and lots of resources that it's really, I think the community really appreciates that you share them openly and publicly and freely. So lots of great resources that you guys have produced. So thanks a lot for doing the presentation.
All right, thank you.
Thank you.
All right, we do our webinars every Wednesday at 11 a.m. Eastern Time, and as you can see, it's always great when you can watch live, as those questions really help enrich the discussion. But when you can't watch live, as I mentioned, we do record these sessions and make them available after the fact on the Knowledge Exchange Network, also free and open to the public, so please don't hesitate to share these presentations with anyone that you think might be interested. Next week, as I mentioned, it's part 2 of our sort of impromptu peer support webinar series where we'll hear from the team from the NICU at Sunnybrook Health Centre in Toronto with a session called The Power of Peer Support, Improving Outcomes in the NICU with a Breastfeeding Peer Counselor Program. And in this webinar, the team behind that program will describe the issues the program and role were designed to address, the initial inspiration, the recruitment and training process, and how the program evolved, and the achievements of the Breastfeeding Peer Counselor. So that'll be a great session and interesting. It'll be interesting to see how it ties in with this one. And then following that on the following week, we'll be hearing from Dr. Roger Zemek, who will have a presentation titled Predicting Persistent Post-Concussion Problems in Pediatrics. And Dr. Zemek and his team conducted a study, which was in fact the largest concussion cohort in the world so far, to derive and validate a clinical risk score to stratify persistent post-concussion syndrome risk occurring after acute concussion in youth using readily available clinical features. So that'll be a really interesting session with the concussion always top of mind for the last couple of years. Lots of media attention and lots of people interested in the topic, so hopefully you'll be able to join us for that session. So lots of great stuff coming up in the next couple of weeks. Thanks again for joining us today, and we hope to see you back here next week. Bye, everyone.